So, excuse me. Welcome to this presentation where we'll be discussing on working with children. Module 4 was a discussion on working with the elderly. The entirety of Module 5A to E will be discussing on how to work with children, because as a caregiver, your assignment may also involve caring with children who would need assistance with activities of daily living. So in this module, we will be discussing the specific needs of children who receive home care services. We'll discuss why children may need home care and how the caregiver can best meet the physical and the psychological needs of such children and their family. We'll also explore children's growth and development, starting from infancy and ending with adolescence. We'll examine how children may react to stress and the various problems that may affect families, such as domestic violence, substance abuse, and mental illness. Then finally, we'll discuss how to help children cope with stress and how to strengthen families. So why do children need home care? Children may face a number of situations in which home care is helpful to provide temporary care to recover from a medical illness or injury, or even long-term care if the child has a chronic illness or disability. So for instance, a child who has a fracture and the parents have to work and there's no in-house caregiver, you may be as a professional caregiver to take care of that child while he or she recovers from the injury, in this case a fracture. Or it could even be a very serious surgery that will warrant some days at home for convalescence, and there's nobody at home who will be able to sit and care for such a child. You may be employed to take care of such a child, or if it's a child who has a chronic illness, kidney failures, excuse me. Excuse me, please. So if it's a child who has a chronic illness or disability, or chronic illness, disability, a child who has Down syndrome, a child who has autism, a child who has kidney failure, end organ failure generally, who will need assistance with activities of daily living on a longer term, you may be employed to care for such a child. Then children who have sustained wounds, burns, or injury from a trauma, such as motor vehicle or sporting accidents, may also benefit from receiving home care services. The child may need special medical care to treat wounds, to perform dressing changes, to receive medications such as intravenous antibiotics. These are medications that are administered through a catheter into a vein. So the child will be able to receive the medical attention they need within their home, while also reducing the financial burden of hospitalization on the patients. Because let's face it, hospitalization could be very expensive. Then children who are mentally or physically disabled may also benefit from services provided by a caregiver and the home healthcare team. Just as you do when you care for an adult with a disability, children with mental or physical disabilities can receive care from a team of physicians, nurses, social workers, respiratory therapists, nutritionists, and you, the caregiver. And by receiving home care services, the child may remain in the comfort of their own home, surrounded by the people and the things they love, while also receiving necessary medical care and assistance with activities of daily living. So home care services for children with disabilities allow them to live as normal a life as possible with their family rather than living in a long-term care facility. So that could be a child with autism, severe autism, with the help of a professional caregiver, such a child will be able to live a life that is as close to normal as possible within the comfort of their own home, rather than being abandoned to a long-term care facility in some cases. Then children can also have chronic illnesses just like adults. Muscular dystrophy is one of such. It's a progressive disease in which there's a gradual wasting away of the muscle. Cerebral palsy is also one of such chronic illnesses. It's a neurological disease which affects motor development. Then children with these disorders have difficulty with using their muscles, and they may need assistance with self-care such as feeding, bathing, toileting. Children who have also suffered from a head or spinal cord injury that has caused permanent brain damage with or without loss of function would, in many cases, need assistance with self-care, and that is where you come in as a caregiver. So here's a picture of a child with cerebral palsy, and as a caregiver attending to the needs of such a child. Then still on why children may need home care. A person with paraplegia, that's inability to use the lower parts of the body, or quadriplegia, that's inability to use both the upper and the lower body, is really not able to care for themselves. So such a person would also need a caregiver. Then children, unfortunately, to also suffer from chronic health conditions like diabetes, heart disorders, respiratory disorders such as cystic fibrosis is a chronic long-term. Even vision and hearing disorders also affect children. Congenital disorders like Down syndrome, which is a genetic disorder that can result in cognitive disability to think, to function effectively, and physical disabilities would also affect or may also affect such children. And as such, receiving home care services will allow the child to receive the medical attention they need within their own home, so that they may be close to their family and what is familiar to them. And this home care service would also help to reduce the cost of hospitalization and long-term care facilities, because these people will need a long-term care and you can't keep them in the hospital indefinitely. Keeping them in care facilities too is equally financially indicting, and even the discomfort, the separation from the family, the back and forth that the family will need to do if their children are admitted away from the house. So you, the caregiver, coming to such a home to care for such a child will provide an immense relief for the child and for the family. So here's the picture of a child with paraplegia. You can see he's in a wheelchair and being cared for by a professional caregiver. So home care services may also be used to help families who have recently given birth to a child who is premature. Premature is a child who is born before they are fully mature in the womb, or who has a physical disability due to a birth defect. So mothers and fathers may be overwhelmed by the care the new babies need, and they may benefit from a home health aid, personal care aid, providing them assistance as they adjust to the needs and the care of their newborn. So a new parent may also need assistance with providing care for the baby, such as feeding, bathing, diapering the baby. So you may be employed to care for a newborn or for a mother who has just recently given birth. So they may also need assistance with providing self-care to the new mother with basic household tasks such as laundry, cleaning, meal prep, meal planning, and shopping. Premature babies are babies who are born before 37 weeks of gestation. The estimated date of delivery for many people is for 40 weeks, plus or minus 2 weeks. So most people will give birth on average between the 38th week and the 40 weeks. So any child who is born before the 37th week is considered a premature. So these babies are born too early and they are not yet fully developed. So such babies will need special care once they are released from the hospital. And special attention must be paid to helping these babies meet their nutritional needs, monitoring the intake and output, weight gain, their vital signs to ensure that they develop in the way they should. And sometimes mothers who have not yet given birth may be put on bed rest to prevent complications of pregnancy. So you may be needed to care for such a woman. So they may need assistance from you, the health caregiver, in meeting their self-care needs and preparing for the coming baby. Now, when a child has suffered from the death of a parent, they may also benefit from receiving home care services. The remaining parent or family members may be overwhelmed emotionally and may be unable to meet the physical and emotional needs of the child. So the health caregiver can provide housekeeping, meal planning, prep, and completion of activities of daily living assistance for the children and the family in these types of situations. And finally, now there are situations in which children face domestic violence, abuse, neglect, or substance abuse by a parent within the home. The home healthcare team can assist the child with meeting his or her physical and emotional needs while monitoring the safety of the child within the home and providing care for the entire family. And with that, we come to the end of this presentation. Thank you for staying with me.